Hey everyone, welcome back to the Career Gems podcast with me, Dr. Nurati. Today on the podcast, my guest and I have very important conversation to have around navigating barriers to success as a career woman in today's world. With me to have this conversation is a head of planning, research, and statistics for Nigeria's National Blood Transfusion Service, and senior health policy advisor with the Department of Hospital Services in Nigeria's Federal Ministry of Health. She has over 18 years of private and public healthcare experience and sits on the governing council of Palmer University of Medical Sciences, Nigeria's first private University of Medical Sciences. She is a fellow of the West African College of Physicians, the Royal Society of Tropical Medicine and Hygiene, and the Royal Society of Public Health, and is a member of the White Ribbon Alliance for Safe Motherhood Global Strategy Advisory Group. That's not all. She also regularly conducts voluntary community medical outreach and advocacy campaigns through her foundation, Kabea Care Foundation Africa, providing medical and educational support for underserved communities in northern Nigeria. She also sits on several boards, volunteers, and supports humanitarian initiatives in blood safety, medical services, maternal child health, literacy, education, women and youth empowerment. She is Dr. Adaeze Oreh. Dr. Adaeze, welcome to the Career Gems podcast.
Thank you so much for inviting me on the podcast, Dr. Nuratu. It's a pleasure.
You're welcome. There's so much more I didn't even say, but I want to give you the opportunity to discuss because you're such an accomplished professional with such diverse experience. I mean, besides being a medical doctor, you have your hands in education, in advocacy, you did a lot of work with the COVID-19 pandemic, right? So I feel like this is an opportunity for us not just to focus on those barriers that I mentioned as a topic, but to highlight some of the amazing work that you've done. So it's a pleasure having you on.
Thank you so much. Thank you. It's a pleasure for me to have this platform to reach the thousands of career professionals who you regularly engage with the podcast. Yeah. I see the podcast as something very impactful, and I do have to say I commend you for what you're doing. And thanks again for the honor of being here.
Yeah, welcome. Welcome. Thanks. So how did you get here? Did you always want to do all the things that you're doing today?
Well, I would say that as at the time I was in medical school, during my first round of clinical postings, I was obsessed with becoming a cardiologist, a heart doctor. And that was because I was being taught by some amazing physicians, and I just saw it as something really important that I wanted to do. And so this was at the start of my clinical training. But by the time I started to advance in the training, I saw that there was a huge gap in terms of the inequities and inequalities in the quality of healthcare, access to funding that prevailed in a lot of our communities, especially for our rural and suburban communities. And so even though I had that love for internal medicine and love for cardiology, I felt that perhaps there were some other colleagues of mine who would be better placed to do that, because I was now fixated on this problem, and I knew that I wanted to work in health policy and address some of these inequities and these gaps that determined the fate of our population. So by virtue of where people were from, or by virtue of the amount of money, their careers or their professions, those things had impacts on how their health would turn out.
Yeah.
And so that's where I started to focus. And since then, I've been trying to advance my expertise, my skills, basically to fight that problem, the problem of health inequity. Yeah. And so I never really planned my career trajectory. I mean, even finding myself working in blood transfusion services, I see as just an example of the work that I can do to address health inequities. And so when I finished my master's in international health management, I thought I would be working in a disease control program. So maybe cancer control or neglected tropical disease program in public health. But at the time, there was no availability in any of those places. And so I was working, doing some private consulting and other things on the side, but I was volunteering my time with the Federal Ministry of Health. So for about 7 to 8 months, I was a volunteer with the Federal Ministry of Health, completely unpaid, but working in different departments and units. And people didn't even know that I wasn't like a core staff, because I would go with them on field work, assist the staff and everything. But what that did for me was it helped me build a network of people who were working in the space that I wanted to work. And so just by virtue of being in that space, I then got wind of an opportunity at the blood transfusion service, because the United States government had just formed a project with the federal government of Nigeria, and someone was being sought to head up the operations for Abuja, Niger, and Nasarawa State. So I thought I was applying for data and information role in the blood service, but because they had that need for a project manager, I was then offered that position. And that's how my journey in blood transfusion services started.
Awesome. I see that you write as well. You're published. Tell us about that.
I will say my writing started when I was about 4 years old. So my father is a medical doctor, and he would spend very long periods of time in his private hospital. He offered private hospital services, and so whenever he would come home and how was your day, myself and my siblings, we would also notice that he had stacks of paper. And so we then bullied him into giving us stacks of paper that we wanted to write. And so I started writing small stories, short stories, drawing things and giving them to him to go and publish. We thought it was that easy to publish. So I would say writing for me started at a very, very young age. And then coupled with the fact that both my parents are very avid readers. So it's something that was always there. But in the course of my clinical training, I would say I was one of those people who was very fastidious about copying very good notes. And maybe that's how I was trying to channel my love for writing. But also because of how exacting the training is clinically, there wasn't that much time. So when I completed the first phase of my clinical training, I said to myself that writing about my opinions and thoughts on health policy and how to get our health system better was something that I felt very strongly about. And once I completed that first phase, I then decided to become more intentional about writing opinion pieces, writing journal papers as well. And so having that mindset of this is something that's important, I started to create time for it. And I just started pitching. I would pitch to journals, I would pitch to newspapers, I would pitch to outlets that I felt spoke to the narrative or whatever piece it was that I had written at the time. And so of course I got lots and lots and lots of rejections. It never gets old. But you always find a home for the piece once it's well written. And some of the outlets would also do something which is helpful, bring suggestions and comments on your piece that can make it stronger. And so even though, of course, human nature, you feel very disappointed, you put your heart and your soul into the piece that you've written, it's also good to take a step back and take in any of the criticism, any of the comments or suggestions that can help make that piece stronger. Because I do know that some of my pieces that have gone through the mill of being corrected and rejected sometimes have turned out stronger, and I'm happier with the pieces at the end of the day when they finally found a home.
Yeah. I mean, there's a common thread with almost all the women I talk about, or I talk with, and when it comes to success, like that common thread is perseverance is really the key to achieve things, right? You have
Yeah.
you have to have the passion, you have to be determined and not be deterred by some of the challenges. And these are
Yes.
some of the things that people don't see on the outside, right? They don't see how many times you did your articles didn't get
No.
picked up. They don't
Yeah.
see how many times you wrote pieces and you were not confident enough to submit them, right? They only see the ones that are published and they're like, oh my gosh, she has all these opportunities, right? How did
Yeah.
she? Yeah. So
Yeah.
this is part of why this platform exists, so that we can talk about the journey of how you got to do these things, and that is not easy, but it can be fun if you're passionate about it. Like
Yeah.
rejection is not a negative. It's like go back and do it better. And in doing that, you kind of brush up your skills and learn new tools on how to present your work, regardless of what type of
Exactly.
work it is. So I'm
Yes.
glad you said that.
Yeah.
Yes.
And the other thing is patience.
Yes.
Patience.
Yeah.
What doesn't work today may work tomorrow. And
Yeah.
this just brought to my mind a conversation I had with a mentee of mine, and an opportunity that she was, very very expectant of, somehow just didn't turn that way. And so when I was having a conversation with her, I said, it's not about you. Sometimes these opportunities are either about the organizing body, about their focus at the time. We're in a very unique period of time. We're in the COVID period.
Yeah.
So you would see opportunities, whereas say maybe five years ago, there was a different focus maybe on people who are working on strengthening health systems.
Yeah.
From 2020 to for the next 3 or 4 years, people who are working in biotechnology, people who are working in vaccines, people who are working with viruses will start to get more opportunities.
Yeah.
So where a couple of years ago, they would have felt, oh, this thing that I'm so passionate about, really, is there any, as we say in Nigeria, is there any head to it?
Yes. Yeah.
You now suddenly see that opportunities are climbing all over themselves for you. And it's just about the timing.
Yeah.
So I try to encourage some of my mentees and say, don't take this disappointment as a slight to yourself. Look at it in a bigger picture. Look at it from the perspective of the entire system. And you'll see that perhaps you were not given this opportunity just because that's not the area they want to focus on now. And that has helped the mindset of, at least my mindset and mindset of a few other people I know, because you can beat yourself down when you don't get some of these opportunities.
Yeah.
Whereas it never had anything to do with you, your capabilities, your expertise, your knowledge. It's just simply not the right time for what you have at it. So just use that opportunity and continue to strengthen your skills, continue to improve on yourself.
Yeah.
And so when the opportunities come, it's almost seamless and it's so easy for you to just step into those roles.
Yeah. I mean, speaking of opportunity, timeliness, and the pandemic, I read that you've done over 40 interviews during the pandemic and written over 60 articles about the COVID-19 pandemic and did a lot of work with the CDC. Like, it's an opportunity, right? These are things that this unfortunate situation brought upon. Like, tell me about the work that you did with CDC and the responsibility you took on for, I mean, the interviews I would assume are about awareness and prevention and things like that, enlightening people about the pandemic as a medical practitioner.
So something interesting happened with the whole COVID-19 pandemic. We're suddenly seeing our mothers who are not medical professionals, our grandmothers, our aunts, our uncles, people who had no medical training were suddenly forwarding a lot of technical virology-based articles, from journals and things. And
Yeah.
I knew that a lot of them didn't really understand the content or the implications of some of those articles. Sometimes they were forwarding them so that they would get responses that might help shed more light on what they
Yeah.
were seeing.
Yeah. WhatsApp was
So
blowing up.
what I mean, no, WhatsApp exploded.
Yes.
So I saw that there was this huge, very wide gap in the information that was out there and the understanding of the information, the understanding of what that information implied for our health and for our future as a race. So while a lot of the technical information was being given out, the presidential task force, the NCDC that did incredible work, was making sure that a lot of the technical information was going out daily, the daily reporting that was accessible via Twitter, via social media. I felt that there was also a need from a physician, a community and family physician perspective to try and break down some of this information that was out there.
Yeah.
Because we could see that there was escalating misinformation. You could see it blatantly, but those of us who could see it clearly were people who had training to understand what we were reading, what we were hearing. But a lot of people just didn't have that. So I then I think it just started with me reaching out to a radio station that I had been working with over time on community and health awareness to say, look, I'm happy to shed some light on some of these COVID-19 pandemic information that's out there, just to speak to the general public and get them to understand. And just like that, I started getting invitations and calls. And so I was doing huge numbers of interviews every week, in addition to the work I had to do at the time. So for me, it was about dispelling a lot of those myths and misconceptions that were just circulating so wildly, getting the information to people in a language that they understand. And that's something that I've tried to emphasize, even in some of the editorial pieces that I've written.
Yeah.
While we're looking at vaccine hesitancy, people are very skeptical. It all boils down to trust and how we communicate. So we really have to leverage our communication systems that are tailored to different segments of the population in ways that are acceptable to them. That way, people understand the information, relate with the information, and are able to process it better.
Yeah, I mean, keyword there, relatability, because I remember having a discussion with a friend of mine. I said around how information was initially being passed in Nigeria specifically about the pandemic. A lot of times they just tell you that, oh, this special advisor passed away. This person came back from Italy and passed away. So it just seemed like it was a rich people disease in the beginning, right? So the grassroots were not relating. They didn't think it would happen to them. They just thought, oh, okay. So the messaging in the beginning was that you have to have traveled abroad and come back in for it to affect you. And then like, I don't even know anybody who has been on a plane. So it really is not my problem, right? So I felt like in the beginning, the messaging was not relatable to people. And I would sit down and have conversations with people that are actually educated and like enlightened people. And then I go, it's their disease, it's not going to pass. It has nothing to do with me, really, because it's karma, it's this, it's that. There was no relatability factor to it. And I think part of why they were successfully able to have like the successful lockdown in places like Italy and the UK, they were showing people the emergency rooms, right? You would put on the TV and you see the emergency rooms, you see no beds, you see people lying down, like people dying, not enough ventilators. Here, they were not showing any of that. You just hear that, oh, so they've gone to isolation center, that's it. We don't even know what the isolation center looks like. So really, there's no way you can picture that this could happen to me.
Yes.
So that
was actually something that we had to deal with. In fact, one of the journalists that I spoke to on a Pidgin English program around the time, I mentioned someone who had recovered from COVID and had subsequently had issues with her landlord. And the journalist was really interested in having her come on the program. But she refused. She wanted to, but her family so strongly warned her about the stigma that she would be exposed to. And at the end of the day, she just felt, you know what, I don't think I can deal with all this. And her own story is reflective of so many people.
Yeah.
And this is because the understanding was suboptimal. If we had a very clear understanding of what the whole pandemic was about, then there would be no reason to stigmatize anyone. There'll be no reason to discriminate against anyone because they had or they were close to someone who had the infection. And so it's still a work in progress. I mean, we're still being confronted with people who have refused to believe that it's not some figment of government's imagination or some strategy to make money. There's still people who believe that, and it's unfortunate, but it needs consistent communication and reaching out to people at their community level.
Oh, that's amazing work you're doing. I mean, I feel like now we get the gist of how amazing you are, what a superstar doctor you are. So now let's move to the meat and potatoes of this conversation, which is the navigation of the barriers to success for women in the workplace, right?
Yeah.
So it's a touchy subject because I find some people feel like, what are the barriers? You're talking to all these awesome women that have all these amazing careers. So then there's no barrier, right? It means there's an opportunity for women to grow and be successful. So what are you guys complaining about? Like, what would you say to someone who says something like that?
I will say that everyone, both male and female, have their unique experiences. And if we look at our own society, the unique experiences of women and the stereotyping that goes along with our perception of women in our own society is in itself a barrier.
Yeah.
Because